We are neither nutritionists or medical providers. The topics discussed on this show are from our own research and experiences. Please consult your medical provider before attempting anything discussed on this show.
Welcome to another episode of
Sjogrens Strong. My name is Lupe.
And this is Brian. And today we have a guest on the show for you. His name is Leo Pranitis, and he is the general manager at, now I'm going to mispronounce this name. I tell you what, Leo, why don't you pronounce the name of the company and the product we're going to talk about tonight?
Absolutely. I'm more than happy to do that. The name of the company is Priscina, and I don't blame you for handing that one over to me, Brian. And the name of the product that we're going to talk about this evening is Moisyn, our new dry mouth product.
And I would have got Moisyn correct because we've been talking about it for the last couple of weeks. But for some reason, I looked at the company name and said, I'm not even going to try.
I don't blame you.
We actually met Leo at the Sjogrens walk in LA about 5-6 weeks ago now. And he and an assistant were handing out samples of Moisyn, the mouth oral rinse, and a spray. And we got to talking about it because, as everyone's aware, with Sjogrens, dry mouth is an issue. And having these samples in our possession, Lupe started utilizing it religiously about a week ago.
Yeah, religiously, yes. I've been using it, but, not religiously until about a week ago.
Yeah, so we've got a good 7 days of consistent twice-a-day use with the rinse and on and off throughout the day with the spray, correct?
Correct, that's correct.
Awesome. So we wanted to invite Leo on the show so, he can pronounce the name of his company and product correctly for you, since I can't.
I'm happy to do that.
All right, Leo, why don't you tell us about Moisyn?
Sure. Well, Moisyn is a very, very unique product in the marketplace, and I'm sure you hear that every day. But I'm hoping that as we talk, you'll realize that what I'm saying is actually true, and it is quite unique. We've developed this product specifically to relieve dry mouth symptoms, and we use lubricants and other items in order to hydrate and soothe the irritated oral surfaces that come from that dry mouth, come from xerostomia. What makes our product a little bit more unique in one regard is that we believe that patients will also experience a cleaner and fresher oral environment due to the molecule that we have integrated into our chemistry, which I'm sure that we'll have an opportunity to talk about that further. But the product is already clinically proven. We did a study with Dr. Joel Epstein, 57 patients, and we found that we were able to achieve some remarkable results. But in summary, the product will moisturize the surfaces. It will also clean the mouth and freshen the breath. It's very soothing, has a mild flavor. It's a very balanced, neutral pH, and I think one of the other interesting aspects to it that I hope we can talk about is how the ingredients are naturally derived and really free of a lot of harsh chemicals and other things that you see in many of the products on the market today, not just in dry mouth, but in oral rinses in general. And so there's a brief overview for you with our product. And as you noted, we have it available in a rinse and as a spray as well, which is what we were giving out at the Sjogrens walk when we all met.
Right. And we've been using both. And when I say I've actually tried the product myself. And to be completely honest, at 4:30, I used the rinse, and I am still over salivating. But I'm not the one with Sjogrens. But
okay. All right.
It works. It is making me produce more saliva than I'm used to, which is interesting to me. I mean, proof of concept. I tried it. It is working. And I have tried
That's good to hear.
About 3-4 different occasions in the last few weeks, and I mean, it's, again, making me produce saliva, so.
That's great. I'm happy to hear that.
So, Leo, was Moisyn designed to relieve the symptoms of dry mouth, or was it discovered to relieve these symptoms?
That's a good question. We designed this product, Moisyn, specifically for this situation, to relieve dry mouth symptoms. It's not something that we if I understand the context of the question, it's not something that we sort of came across as we were doing something else. We actually developed this product specifically to address dry mouth. A little bit, if I may, and Brian, tell me if I'm off topic, but the company Priscilla is a division of another company called Synogen, and Synogen was the originator of this core molecule that we use in our Moisyn product, and also in our Synodent daily oral rinses. We take this core molecule and we purpose it for a variety of aspects, and we're doing it. Synogen is doing it across a variety of other medical needs as well. Anywhere that we can address either a dysfunctioning or non-functioning mucosal surface, and work to restore that function back with this molecule that we've created, then we believe there's a purpose for us to develop a business around it. And Priscilla, fortunately for me, Priscilla is our oral rinse division, and that division is farther along, and so that's why we're at commercial level. Some of the other businesses are not quite there yet. But a little bit of background for you. So, long answer to a short question, Lupe.
That's
but
okay.
Yes,
that's okay.
We did develop this product. Moisyn is developed specifically for this.
Is the mission of the company mainly focused on oral hygiene?
So certainly Priscilla is. Priscilla is an oral healthcare company. We are all about oral wellness. And we have the daily oral rinse, and then we have Moisyn, but we certainly, as you could expect, we do have other products in the pipeline slated for release over the next few years that will also address other circumstances and other needs within oral wellness. And specifically what I mean is products that are geared toward more extreme conditions, oral mucositis, things like that. And also then building out the product line around Moisyn and Synodent in terms of other delivery options for this product.
So are you guys going to develop toothpaste also? Well,
it's certainly a very strong possibility. It's a very, very strong possibility. I just, I'm not trying to be glib. I'm saying it that way because I don't have one to show you a picture of right now. But
gotcha.
I would say, as we build out the portfolio, we have to balance the needs of the business in terms of what we can develop and how we can also differentiate in that space. And so if we believe that we can take this molecule and differentiate within the toothpaste space, then you could expect that we would bring one to market.
Yeah, that would actually be awesome. What are the active ingredients in this product?
Yeah, so that's great. I'm so glad you asked, because now we can get into the nitty gritty, right? We can talk a little bit about the molecule, this hallowed molecule that I've been talking about, that I've mentioned a number of times since we started talking. Mm-hmm. And you have to be careful, right? I mean, this is recorded. We're going to put this out, and a lot of different people will hear it. And so there are certain phrases and words and things that you can say and things you can't say, because Moisyn is, we went through the FDA approval process, and so we have specific claims that we can make. So you have to be careful about the words active ingredients. And I think what you're asking, correct me if I'm wrong, but I think what you're asking is what's important about our formulation, about our chemistry that makes us unique. And so I'll answer it that way, and then you can tell me if
that's correct. That was my question. I guess I just
okay,
yeah.
Great. And so so our core molecule consists of two main components, and the first component is arginine, and arginine is widely known as an amino acid. It's found in the body. But the beauty of arginine, the beauty of integrating arginine into any molecular structure, is twofold, primarily twofold. First of all, it has a positive charge, and mucosal surfaces have a negative charge. And the beauty of having something that has a positive charge is that it's inclined to attract to a negative charge, and in this case, the mucosal surface, and stick around. And so that's one aspect of arginine that's really, really important. The other aspect of it is that arginine is great. It does a great job in balancing the pH. And never is it more important to balance the pH than it is, or I shouldn't say never, but it's very important to balance the pH in the oral environment, because once the pH gets out of balance, then you are essentially setting up shop and inviting all sorts of other deleterious things to happen. And so arginine does those two things really, really well. Now, the other component, so that's the first one, and the other main component, Munchium component, is chitosan. And when I say chitosan, you may be thinking in your head that starts with a K, and it actually starts with a CH. It's CHITOSAN, chitosan. And chitosan in various forms has been widely researched and widely known for nearly 100 years now for certain characteristics. And those characteristics look a little bit like this. They have a capability to aggregate debris and pull it together. They also, chitosan in other uses has demonstrated activity as in supporting wound healing. And in our case, we take chitosan, which is derived from the shells of shrimp, and we bring it into our facility, and we utilize a patented and proprietary process that allows our chitosan, our synthesized chitosan, to reduce the bacterial binding to tissues and protect mucosal surfaces and restore function, restore healthy function back to the mucosal surface. There's another aspect that's really interesting about chitosan, and that is that it is uniquely built to absorb, to invite moisture. And so you've got this, if I put it all together, you've got arginine that has a positive charge, brings things to the mucosal surface, which is a negative charge. It also balances the pH. And in our case, it's bringing chitosan, which is clarifying and purifying, and it's also attracting moisture. And so if you can imagine in the case of either a daily oral rinse, where you've got this clarifying, purifying aspect that is pH balance, and then when you dial up this molecule that is attracting moisture and also attaching itself to the mucosal surface through the positive charge and balancing the pH while it's there, you can see this is a very sophisticated science that we have brought to oral wellness. Very, very sophisticated. And we take this same molecule at our parent company level. We take this same concept and this same molecular innovation, novel innovation, and we apply it to other businesses, other businesses, yes, but other industries, I should say, in the medical field, such as wound care and nasal care and lung care and GI. It can and will and have purposes across all of those areas. And so you can see, obviously, I'm very passionate about it. You can tell that. Hopefully you can tell that. It should be coming through.
Yes.
Yep. But it's a great story to tell, because this is a naturally derived story that is based on real science and is now, in our case, is also clinically proven as well. And so I'll park there. There's probably some questions around that, but that's the core essence of this novel innovation that we're bringing to oral healthcare.
Well, let's see. In 8th grade biology, I killed the goldfish, and I'm very happy there's smarter people than me out there working in a lab coming up with such cool products. So
Me too.
No, I understand some of the basic science there, but I mean, it's definitely over my head. But it's a cool product that, I mean, just the way I've experienced it so far, I'm like, okay, this has to help. Now, we understand that everybody's body is different and reacts differently, and the severity of the damage to salivary glands, depending on how long you've had Sjogrens and how well you're taking care of, treating your Sjogrens. What are some of the average responses you had during the clinical trial, and then maybe with testimonials after the fact?
Right. So we've had a couple of interesting, events that have occurred. One event, of course, was the clinical study that I had mentioned earlier. That was with 57 patients. That study has been published now in the publication Oral Surgery, Oral Medicine, Oral Pathology, Oral Radiology, which I think qualifies as one of the longest names of any publication ever. In that study, in that clinical study, patients were using Moisyn. They were using the rinse in the mornings and then before bedtime at night, and they were using the mist, the spray, as needed, as they felt they needed. But some of the interesting symptoms that were treated included a reduced dry mouth, reduced mouth pain, improved ability to sleep, improved sense of taste. 84% of the users would use it again. 81% had at least 30 minutes or longer. And there was also a 30% decrease in pain affecting sleep. Another interesting, data point, we had a 100% improvement in whole unstimulated, in other words, resting saliva. And so, this speaks to this aspect of the arginine bringing the chitosan to the surface, the chitosan bringing moisture to the surface, and doing it in a very pH balanced way. And especially when you start thinking about pain, pain that occurs from dryness around sleep. That can be particularly debilitating, as you know. And so we felt that was obviously those are very. I was going to use the word encouraging, but I think it's more than encouraging, right? Those are great data points. Those are really great points. Now, when you get into surveying, so we attended an event in New York City. The Sjogrens Foundation had an all-day session, and we had a table there, and I got a chance to speak to probably over 100 people that were suffering from Sjogrens, and we gave away a lot of samples that day. At that point, we'd only had the mist available, and so we reached out to many of the people who received the mist, and we got we were able to get 19 people that agreed after using it for a week to come back and give us some survey points, and we were able to get some interesting things. 79% of the users would recommend the product. We were seeing comments that suggested relief for some, and it's important to be honest, right? For some, up as much as 4 hours of relief, which we know is pretty significant. And so, we've been very encouraged. And when we get these types of things that happen, and we're able to speak to people that have been able to receive relief, it energizes us. It's very energizing and gratifying to be able to do that. And so those are some data points that I think are important for us.
Those data points, I think I read that in the study when I was doing a little bit of research prior to this. Just the fact that many people would recommend the product, I thought was really, a cool data point. So congratulations on that one.
I'll tell you a story, and you can take it for what it's worth, right? Stories are just that. They're anecdotes. I think it's a good one. And actually, I've had this happen a couple of times. But when I first started with the company, which it's only been since April now, within the first week, I received more than one phone call, and the phone calls were very they were very specific, and they were very heartfelt, and it was patients who had taken part in the study, in the Epstein study. And when they were taking part in the Epstein study, they were using Moisyn, and the product had not yet been cleared for use. It was all done under IRB and other, all the other legal aspects that have to be taken care of. And so we did the study, and of course we didn't launch the product until this spring. And so there was a pretty good time frame there where patients who were in the study tried the product, got relief, and then couldn't get it. And within my first week in the job, I got more than one phone call, a couple, in fact, of people who were saying, I need this product. I can't, I've tried everything. I was in the study. I was so happy. And then then you took it away. And I said, I'm really sorry. It's not available yet, but it will be soon. And I've spoken personally with those people since then and made sure that they got some product to get them started. But when you hear that,
that's gotta feel, it's gotta make you feel really, exactly.
It does.
Not sure if it was on the website or in some of the materials I read. I understand that there is a sugar-based carb in the product. How, if that is true, if I'm not misunderstanding the documentation, what effects does that have on the health of the teeth?
Yeah, I mean, it's a very interesting question. I can tell you that we don't use the term sugar-based, carb or carbohydrate anywhere within the organization. Polysaccharide, I think, is really, that's the term. Because glycomics, if you look at Synogen, which is our parent company, they are committed to the study of glycomics, which is the study of complex sugar structures that exist within the body. And so when you look at these, organic compounds, right, carbohydrate is a group of organic compounds consisting of carbon and nitrogen and oxygen and those things. But and sugars are found in a variety of forms. There's the sugar we put in our coffee, and then there's the complex sugar structures that are sitting on our cell structure on our body and in the tissue structures. And those two are very, very different things. And so the study and the work that we're doing is around studying glycomics or the study of complex sugars. And then taking these naturally derived, these biocompatible polysaccharides that exist in nature, and fine tuning them via this molecule that I described earlier in order to do the job that it has to do. And so, while I think, people like myself, right, who are not, I'm not a scientist, while I would hear these words like, carbohydrate or sugar, I might think something that is at a macro level that you find in food, when in fact, these are molecular structures and are designed to do very specific things at a molecular level. Does that make sense?
It does.
Got it. It's a good question.
I have a question. Is this product for sale at stores yet?
We sell the product on our website,
okay,
and on Amazon. The product is available on Amazon as well. Should we sell it in local stores? I think we should. Have we contemplated that? You bet we have. Has work been put forth in order to get us there yet? Not a lot. But I do envision a day down the road where this product would be available at a retail level, either in a regional small scale or in a large scale boutique scale. Not sure yet. I think it deserves that. I believe it deserves that. I believe it's that unique. I believe it's that special. I'm that confident in our intellectual property, and I think that it certainly deserves that based on how well it can work and what we could bring to people.
Absolutely. I was just, I just asked because I've never seen it in stores. That's why.
Right. Yeah, it's not sitting next to biotin yet, but I can envision a day when it might be.
Yeah.
It's relatively new. You guys launched September of this year, correct?
Yeah, the rinse was launched. So the mist, the spray was launched in June, okay. and that was kind of a soft launch, a sort of a limited launch, because we knew that the rinse really was the product that real sufferers would be using every day. And the rinse, you're absolutely right. The rinse was then introduced in September. So yeah, we're early on in this, but boy, we've been incredibly busy. It's been great.
That's good. That's awesome. That's a good problem. Not a problem, but you know what I mean.
Good problem to have.
Are rheumatologists or dentists being provided with samples for patients?
Yes, we're doing quite a bit of sampling within the dental community right now. I'll be more specific. We're working very closely with the hygiene community, because the hygiene community is, for obvious reasons, the hygiene community, it really owns much of the conversation with the daily patient, and they see a lot of these symptoms earlier than say the practicing dentist does, and so we're spending a lot of time with the hygiene community in particular, and dry mouth and arginine and pH balance. All of those topics are widespread popular topics within the hygiene community and within the hygiene thought leadership. So spending a lot of time there, and we're being pretty liberal with samples within that community. Rheumatology in particular is an area that we have not yet penetrated. I'm actually going to a rheumatology meeting later this week for the first time, and so I'm doing some fact finding and some discovery. We do have connections to the rheumatology field, obviously through Sjogrens, but also some of our board members. We have a cardiologist on our board, and he has connections through in the rheumatology field as well. And so I do expect that we'll be growing our presence within that space down the road as well. We do spend, primarily for 2019, our focus is going to be around hygiene and certainly focusing with the Sjogrens community. I do feel as though with Sjogrens, if we can show some significant benefit to this group, this community in particular, then that says a lot about our capability of our product. And so, putting our money where our mouth is, right, I guess is what they say. No pun intended there. But I think it's a really important community for us. The Sjogrens community is. And we're, as evidenced by the fact we're corporate sponsors, I met you guys at the event, and we plan on doing a lot more of those events. And so rheumatology is going to be an important area for us as well. Just haven't penetrated there yet.
I don't know. I think my wife's a dental freak because she's there like every 2 months.
He called me a freak earlier too.
Me, I've got to be in a lot of pain to go see a dentist for the most part.
Preventive care, right?
No,
preventive
care. You got to go twice a year. Got to go twice a year, man, at least. I go 3 times a year.
See, he's just like me.
I think I was traumatized as a child at the dentist or something. I've got some suppressed memories because it's. I mean, I share with people. I was a Marine. I spent time as a correctional officer. I've had no problem, swinging and fighting if need be. But I'm visibly shaking and just anxiety when that topic comes up. So I don't know what it is.
Well, I don't know what to say other than, the research out there suggests that you should get your teeth cleaned at least a couple times a year. And when you do that, then they'll be able to diagnose other things that may be emerging, and they can nip those in the bud long before they become a bigger problem. And I'm sure Lupe is appreciating everything I'm saying.
Absolutely. Right, preventive care. I go 3, sometimes 4. And he calls me a freak.
She's a freak.
That was even before I knew I had Sjogrens.
No, clean mouth, that's the gateway to everything that's good.
That's right.
That's the gateway that's everything that's good. That's good,
yeah.
Brian.
You saw the links I provided in that email. Are there any links you'd like me to provide that aren't present in that document?
Well, we certainly have our website, and as I mentioned, you can learn more about our company. Be advised, though, for any of our listeners and for the two of you as well, that our website is about to undergo a pretty big overhaul, and I think between now and before the end of the year is up, you can expect to see a completely new and revised website experience, which I could not be more excited about. It's been a lot of sleepless nights and it's a lot of work, but I couldn't be more excited about it. And so I would, if anybody's listening to this and they happen to go to our website, soon, then they may not see the new website. So please come back and visit us often. You've noted that we have a Facebook presence and an Instagram presence, and Twitter, which feeds from those. We do have a LinkedIn page, and we do post things that are new there on LinkedIn. I typically will post those things and repost those things myself on my LinkedIn presence, and so you can catch those on either one. I would urge anybody who's listening to jump in on those and look at the conversation that we're trying to conduct. But I think Instagram and Facebook, we're quite we're quite busy on those, and we're going to continue to provide not just these are not just promotional vehicles. These are educational and informational vehicles, not only about ourselves but about the world that we're in. And so I would urge people to check them out and follow us, and you have my commitment that we're going to continue to build those and nurture those and foster those so that we have a really good experience for everybody who visits us. And so, yes, I think those links are good, and you can find us there. Thank you for doing that.
The whole motivation for us doing this is to bring information to people and stay away from the negativity and focus on the positivity. And even though you're living with Sjogrens, you can still live Sjogrens strong. So that's
great.
That's what we're all about. Well, any parting words that you'd like to leave with the listeners?
Well, I think before I talk to the listeners, Brian, I've got to just remind you, you got to get to the dentist, man. You got to go get your teeth cleaned. I mean, you know, I'll pick you up, Lupe. I'll pick you up, Lupe. Then we'll pick him up together, and then we'll take him there, and we'll get this taken care of. But I think no, I appreciate you letting me come into your house and join you on this podcast. I commend you tremendously for doing it in a positive way. Brian, I think we just put the finishing touches on Veterans Day, and so thank you for that as well. I think that's an important consideration as well, because we're talking to you today, and yesterday was Veterans Day. And I just want everybody to know that our organization, Priscina, is we are dedicated to talking to people. We are dedicated to learning what people are wrestling with. And we know that if we do that, then we're going to make a better product. We're going to put together a better message. We're going to be more connected to our audience. And I think that's what it's all about these days, is being able to have that connection and understand that everybody's different. Everybody's circumstances are a little bit different, but boy, I certainly hope, if nothing else comes out of this, that everybody's heard my passion for this technology and this science and for what it is we're trying to do. And I appreciate you very much for giving me the opportunity to do that.
We can hear your passion, definitely.
Good. That's good.
Yeah.
I'm glad to hear it.
Yeah, we know. And we kind of have the same thoughts on social media, that it's not just a vehicle for sharing my half-eaten plate of food, but one that can be utilized to share experiences and learn from one another, and break down some of the walls that are up. So to all of our listeners, we encourage you to at least go check out Priscina and Moisyn. This is not a sponsored episode. Again, we met at a Sjogrens walk, and he was kind enough to leave some samples with us that we tried, and we thought we'd share these experiences with you. So give them a look if you're dealing with dry mouth or looking for a dry mouth product, or maybe want to try a new dry mouth product. Give it a try.
Thank you.
Okay, so I've been using both the rinse and the spray for about a week now, and I get about an hour of saliva production every time I use it. I like the spray because it's handy and it provides immediate relief throughout the day as needed. Now, keep in mind that not every product works the same for everyone, but it's worth giving something new a try. When I'm out living Sjogrens strong, it's nice to have something handy so I can focus on having fun and not my dry mouth.
Thanks for listening to another episode of
Sjogrens Strong.
And be sure to check us out on
Instagram,
Facebook,
and Twitter.
And don't forget sjogrensstrong.com. Till next time,
talk soon.